may sometimes wonder why patients with the same condition, the same disease, have such different symptoms and react differently to treatment. The symptoms and the way they cope with the problems depend on each individual. A patient with osteoarthritis may have pain, but several patients with the same disease have no pain. Patients with the same type of Parkinson's disease have different symptoms, and it seems that even the body reaction to the same condition are different for each person, as if the difference, the way stimuli are interpreted, generate different reaction to each person. Why?
Hello. It is in fact like you're saying, like you're describing, and hence the difficulty in clinical approach to complex things. As living beings, we are complex adaptive systems. This means many variables, many equations, all intertwined within each other. And so if you touch one variable, some other variable that you might know or that you might not know is going to change. There's a problem of the anatomic problems, of the physiological problems. There's a problem of the response and sensing of these kinds of problems within the body. And there is a clinical problem of testing the body and trying to ascertain what the problem within a particular person it is. So today we have an interesting chat about that.
An era is coming in medicine in which we are beginning to understand systems that have not been considered in the treatment of the patient until now. In this webinar, we'll talk about how this adaptive system can be influenced. In the moment we end this presentation, which will last about half an hour, we will be happy to answer your question. On the left side of the screen, a column will open in which you will be asked at the end. I hope you will enjoy us in this paradigm shift. And we are fortunate to have Dr. Medina. Then please.
Thank you very much, Fabiola. My name is Jose Alejandro Medina. I'm Chief of Staff of Internal Medicine, and I'm thrilled to be with you today. You're very welcome here. And Fabiola, she's a physical therapist and master in neurosciences with her own clinic here in Spain, in Tenerife. And we are both very proud of taking part in this endeavor with you. So let us begin. When we consider what we are going to do with the microcurrent system, we need to first take a look at the biological point of view. We need to consider everything in terms of biology and evolution, everything. So in the beginning, there was time. And after that, there was electricity. What do I mean with this? People in the clinical world, even before Sir William Osler, with his revolutionary view into medicine, have tried to harness nature's powers to heal people or to diagnose people. And electricity is central to that. The ancient Romans used it to try to heal gout patients. They used eels and in special water reservoirs. So it goes back a long time ago. In the aftermath of the Middle Ages, in the Renaissance, Luigi Galvani discovered that electricity is part of life. And after that, 2 points of view, two completely antagonistic points of view diverged. One was the mechanistic point of view, and one was the vitalistic point of view. It is very important that we understand this. According to Robert Becker, this is the beginning of the split of the clinical consideration of life of living systems. So the mechanicists saw living bodies as biological machines, and by improving in engineering and in the physical science and in the fluid mechanics and solid mechanics, one should unravel the mysteries of life. That was the mechanicist's view. The vitalist's view, not disregarding this part of life, saw that there was some kind of spark in the machine, that life was fueled by some kind of primordial energy. In the beginning of the 20th century, the split was really severe, and most of the people that tried to consider were losing the battle, the dialectic battle. This changed a little bit when in 1952 Huxley and collaborators described the action potential, hence describing that our nerve and muscle system have a way of self stimulating and also to propagate these stimuli towards their neighboring cells or even further on. This is really important because for it was triggered and it was shown that electricity is crucial to life. So with the decades past, we learned that how this bioelectricity worked, and we also learned that it was not a all or nothing threshold as in the action potential. You see, we all know that in epithelia and also in other tissues, electricity patterns can help the systems to communicate within each other and to propagate signals, signals of health, but also signals of disease. So we can go from maybe a small LED on and off, on and off. You can do a very simple message. But if you consider infinite LEDs switching on and off, you can see patterns. And these patterns can help us translate the signaling and the messaging of our own body. This is the way the autonomous nervous system works, and this is also the way that we can try to measure the basic homeostasis in our body. And speaking of the autonomous nervous system, we all have studied that there are of two separations of the same system, when in fact there are three, but we are going to discuss that later. We in college and university we're told that the sympathetic nervous system takes care of the fight or flight response in all our cells and tissues, and the parasympathetic nervous system is the one in charge of the rest and digest responses. It is not purely so, but it is a nice way of looking at two systems that do not fight against each other, but rather try to collaborate. I usually put an example. If a young student has an oral examination and has not been so thorough in his or her studies, maybe his sympathetic nervous system is going to be triggered, and maybe his pupils are going to be dilated, his heart rate is going to rise, and his blood pressure is also going to rise. But I'm afraid also his parasympathetic nervous system is going to be triggered. And maybe he has a slight urge to visit the loo, especially minutes before the examination, if he doesn't control this. So, in this really simple example, we can see that both systems can be active and reaching towards the same direction. And sometimes these situations fly off the roof and become out of control. And can we think that the autonomous nervous system might have a role to play in some diseases where it is not that obvious? Well, if we consider how the system is regulated, we might be able to predict a pathophysiology of dysautonomic problems within patients that are not diagnosed of autonomic nervous system diseases. So, on the periphery, we have the efferents and the manifestations of the sympathetic and parasympathetic nervous system. We all know the actions of the vagus nerve within our viscera. We all know that lately there's rivers of ink being written concerning the interactions of the vagus nerve and the neuropods within the gut with the gut microbiome, and its relationship with our senses, with our impulses, with our emotions. So we can see that the main director and in this downwards flowing um, hierarchical system is the limbic system. Our emotions are going to be the ones directing the autonomic nervous system. From that on, the hypothalamus, where all the main endocrine functions are coordinated, and the brainstem, where all our internal organs are switched into our central nervous system, are going to process the information that comes via the afferents. And via the spinal cord and the main departments of the autonomic nervous system, the afferents are going to trigger the signals. So the autonomic nervous system can be viewed as an interoceptive and also exteroceptive response system. It is permanently signaling data and permanently giving biofeedback. One of the main manifestations of this duality of autonomic nervous system is going to be sleep. So sleep, the realm of the Greek god Morpheus, is a complex realm, because in our sleep we have many things going on. And since the 1960s, more or less, two modes have been completely well described with the modern EEG techniques. And that would be the rapid eye movement mode and the non-rapid eye movement mode, which can also be subdivided into different sleep phases, all well characterized via the specific waves in the EEG, and also via the depth of the sleep. Sleeps we are going to have in every phase, but we're going to remember the ones from the REM mode. The REM mode is going to be a realm of the sympathetic nervous system, while the non-REM mode is going to be more tributary to the parasympathetic nervous system. How many of us have everyday patients with some kind of sleep disturbance, be it sleep deprivation, be it daily sleepiness, or even more complex problems like narcolepsia or cataplegia attacks or something like that? We all see these kinds of patients. So, and if we say that sleep is paramount to autonomic nervous system functioning, and sleep is a common problem in our patients, how many of our patients with chronic disease, with immune diseases, with memory problems, with cognitive decline, or with pelvic floor issues cannot benefit, even if it were only from a slight improvement in sleep quality?
Well, this is the question. Um, what happens if we not only can influence in the autonomic nervous system, also we can uh, we can know more about this system and learn more about this system for help our patients. This is what we discover with this technology, with the NESA non-invasive neuromodulation. This device is some gloves and anklets that have 24 electrodes connected in the peripheral principal branch of the nervous system, and the hands and the feet connect each other, and the electricity, this microcurrent, run around the whole body, not only in the peripheral part, not only in the central, in the whole body. And then we have other electrode, the fifth electrode, that is the directional electrode, and we can place it we can place it in the place that we want. It depends of the goal with the patient, and it closes the circuit. Then this microcurrent enters in the afferent pathways into the brain, and the brain gets the response. This is a response treatment. Nowadays, there is a lot of clinics. There are more than 1,200 clinics and hospitals in the whole world, and we have the main certifications for work in the principal places that you can see, and then we have also um, some universities and hospitals that are collaborating around the world for make research, because of course research is the most important thing for treat the patient and can give these results.
Regarding medical evidence, well, we can say that it is slowly piling up and improving year by year in quality. As Fabiola is going to explain, the device uses microcurrents that are really, really hard to perceive by the patients. So this has a really, really big advantage. It allows us to perform randomized clinical trials whenever the possibility is done. But as with differences to other systems in which the currents are felt by the patient, there's there's no way to produce a placebo counterpart of the main device, and in NESA we can do that. So even with small n's that are in some of the clinical trials, we're going to see that the clinical quality of the trials is going to be meeting high standards. So as you can see, we have in many topics, and even more is coming our way this year, and most of them are having to do immediately with autonomic nervous system. You see sleep disorders, you see long COVID, which is now recognized as a form of chronic dysautonomia. But you see other things in which the role of autonomic nervous system, it is present, but is maybe not so evident, like in uh, knee prosthetic surgery, in other orthopedic knee problems, in fibromyalgia, and even in cancer therapy. So, as I was telling you, the research is starting to accrue, and this slide shows by no means a meta-analysis of randomized clinical trials, but is a pooled evidence of what we've found so far. And you can see some of the figures are quite interesting, like more than 65% enhancement in quality of life, an increase in sleep duration, an improvement in constipation, and betterment of sleep quality. Many things that are really, for me as an internist, really difficult to come by solely by pharmacological interventions.
Well, what we are talking about? We are talking about a microcurrent that is a biphysical symmetric microcurrent with a low, very low frequency and very low parameters. The current is for 100 to 900 microamperes, and the frequency is for 1.14 to 14.28 hertz. And the only parameter that can we modulate is the voltage. We can choose between low and high, is 3 volts or 6 volts. But we always use the 3 volts for the normal treatments. And the special things, because you say, well, this is a normal microcurrent, but the special way that we use this is that the hands connect with the feet and we make a global neuromodulation. And the sequences are very special because we have 9 configurable programs that change each sequence. For example, we can imagine that each program have 100 or 200 of sequences, and each one have a duration of 1 second, 130 milliseconds. And then in these sequences, we can see how the polarity of this electrode in the hands and feet change continually. But it changes not in the same way. It changes with special parameters. And this is what they do. This technology start in Japan in the 80s, 90s years, and they discovered this, or they research about these sequences, but then the project in this moment the technology was not so high, and the project stopped. And now, in the last 10 years, it continued in Spain, and we can see that these sequences, we can continue with a video, and we can see what each sequence is made. If you see, the right hand connect with the right foot and the left hand with the left foot, and they are changing the polarity the whole time. And that they take this information for these pathways and get into the brain. And then we can see results. What we see, we are talking about the results right now, but the first thing that we notice is an improvement in the quality of sleep because of this bioelectricity that Dr. Medina talked before. We are discovered that the body is not only the chemist part. We have a bioelectricity information that rules in a lot of systems in the body. How we use this technology? We have to choose about two variables for treat our patients. The first variable is where we are going to get the electrode, directional electrode in the body. We have three different ways. We can get the electrode in the neck and make a central treatment. This is a global treatment. Or we can take the electrode in the different segmental parts in the metameras. Then is a territory innervation treatment. We can go to the root, to specific pathways for treat a specific innervation. Or we can take the electrode, this directional electrode that closes the circuit, and put the electrode in a specific way, in a specific area in the body. For example, we use a lot the electrode in the sternal area for treat the vagus tone. We can treat the anxiety with the tonus of the vagus nerve. We can choose the electrode and put in the frontal part for treat the suprachiasmatic nucleus, or it depends of the clinical reasoning. Then these localizations are going to change with the time. In the first, second, or third treatment, we are going to make a central treatment, a global treatment, and then in the way that the treatment is ruling, is happening, maybe in the second week or the third week, we are going to change this electrode for get more specific targets. For if we have a pain in the knee or we have other goals, we can change the electrode and focus the treatment in a specific area. But remember, the treatment is going to get or influence in the whole body because it enters in hands and in feet. Then we choose the programs. The programs, we have 9 programs, and each one is very different and do different things. Don't worry about this part because you have all the information in a campus, in a clinical campus, and also you have an expert, online expert for know more about this. But we have these 9 programs. This is my favorite part because if we combine these programs, then it's like magic. Okay, we can improve the quality of life of patient in a way that I never do before. Then the program 1 is the home program because it's very, very quiet program we use for the hormesis. The hormesis is the minimum doses necessary for needed for get stimuli and reactions without side effects. They have a lot of pauses and it's very, very soft program, and we use always in the beginning. We use once or twice, and then we don't use more because it's very soft. Then we have the program 2, program 3, and program 4. These 3 programs are the same program, but each one enters in different pathways in the terminal sensitive nerves. Then they influence in different areas. The first one, the program 2, is the ventral area. It gets in all the ventral area. The program 3 is going to influence in the dorsal area. And the program 4 is going to influence in the sagittal or side part of the body. Then For example, the ventral area we use for the ventral part of the vagus nerve. The dorsal area we use for back pain or lumbosciatalgias or all the things that influence in the back. And the sagittal area, this stabilizations part of the muscles like gluteus medius or largus dorsal, these muscles are going to stabilize the body. And we use in sports and we use with neurological patients because we can improve the walk of a patient with this. Then the next program is the program 5. The program 5, it's not for an area, it's for an action. And the action is improve the fatigue of the patient. Then we have sometimes pain in the patients because they have fatigue. We can have fatigue in the muscles, and it means it represents some kind of pain in the patient. If we can this research this with we get not well, energy is it's not energy, no, well, it's energy also, but if you get this resource to the patient, then they can improve the quality of life also. Then we have the program 6, and the program 6 is for neuropathic pain and also sometimes for nociceptive pain. But the problem is when we have central sensibilization pain, then the program 6 is not so effective, and we go to the program 7. The program 7 is for the autonomic nervous system, and we can treat central sensibilization modulating the autonomic nervous system, and we get some very great results with this. Now, in a moment, Dr. Medina will talk about all the indication of the technology, but the most of them, they are with the most important program is the program 7. Then we can improve the sleep quality. This is the most important. We can decrease the anxiety of the patients. We can also improve the overactive bladder and the regeneration of the tissues. Because sometimes, if we don't have any problem for regenerate, the body is going to get its jobs, and it's not going to be any problem. But you know that there is patients that have some problems with the regeneration, and the body is not working in a good way. We say always that it's a vascular problem, but this vascular problem is ruled for the autonomic nervous system, and we can modulate this, and we can see results in the hearts of the bones of the patients. Then the program 8 is for the central nervous system. We can influence in the focus and the migraine. In patients with autism, we are not going to make anything. We are not to help anything, but we can influence and improve the quality of life of these patients. And then we have the program 9, and the program 9 is for the cranial area. We can treat the trigeminal nerve and the facial nerve, and we can improve pulses of bell pulses, of facial pulses, and also the trigeminal neuralgias. Then it's a very useful program. Sometimes we have migraines with a trigeminal problem, and in this case we can treat with the program 9 also. Then we have all these tools, and we combine it for get the results with the patients. How we do get this information for know which program it's going to be used? Well, then we have this important part that is the clinical reasoning. It's not only in this technology, of course, we need the clinical reasoning for each treatment, for know how to treat the patients. Then we get this information, this anamnesis for the patient, we get all the information, and then we get some targets with the patient. Sometimes we can talk with the patient which are going to be the targets. And with these targets, we plan a timing. How is going to how long is going to be the treatment? Well, it depends of the patient. It depends of the comorbidities of how long does this problem get with the patients, or it depends of the age or of the condition of the patient. Okay, on the condition of the trigger of the problem also. And then we can choose which programs we are going to combine, because we can combine the programs. This is all in the clinical campus. And where are going to put the electrode? Because maybe the people have digestive problem or have other problem that can influence in the first condition that we are measuring. And of course, we make an evaluation, and when we finish, we should to reevaluate for know how to continue. And now it's very important to know the applications.
Thank you, Fabiola. I want to remind you that if you have questions, I would suggest that you kindly write them down, maybe save them for later because maybe they're going to be answered along the chat. But if not, you just can copy and paste them in the question and answers chat, so we can refer to them later on. So I want now to make a reflection on something Fabiola told us now. So just consider the combinatoric explosion we have when we have a device that has 9 different programs and many different sites of applications within plenty of sessions that we can organize in 2 different intensities, as Fabiola told us. So this is going to be one of the main explanations that NESA has shown in the last years to have many more applications than were initially devised. So in the center of it, we're going to have sleep quality because this is, as we previously discussed, crucial to autonomic functioning. So if the device is going to modulate autonomic nervous system function, then for sure it's going to influence sleep. And it's really effective at that. And there's plenty of evidence and more coming our way. On the left-hand side, we have some things that we're going to discuss in the next slide with the cautions and contraindications, because the device is going to be usable in injury recovery, albeit with caution, because as any current therapy, there has to be some kind of indemnity of the skin where the electrodes are going to be placed. Still, NESA is going to help improve and prevent malfunctioning scar tissue form. In terms of sports performance, we have seen in basketball and football players in Spain and outside of Spain that by improving sleep quality, but also by other mechanisms not related directly to sleep, the athlete improves in his or her performance, and this can trigger also a way to devise for trainers and professional sports physical therapists to prevent lesions in professional sports performers. It's also going to help in anxiety and stress, and in fact, it has shown to modulate alpha brain activity, and it is nowadays currently used by many psychologists in Spain along normal conventional therapy. When we go a little bit downwards, literally and also mentally, we can see that there are applications in pelvic floor, and especially in overactive bladder, in which NESA has proven to be equivalent to posterior tibial nerve stimulation, with the additional benefits of better sleep quality and better an improvement in quality of life measurements. We're going to see that in a while. So it's also going to help with chronic and neuropathic pain, and this there is an amounting evidence even in patients as difficult as multiple sclerosis patients, and it's also helping pedagogists and curators to help children with neurodiversity problems, especially with autistic spectrum disorder. And as I previously said, we're going to discuss what are the main contraindications. Well, It is a current therapy, even though it is microcurrent. We need to consider the absolute contraindications of any kind of electrical treatment. Patients with pacemakers or any kind of electronic device not able to be shut down are going to be uh, off the therapy. We don't know anything about pregnant women, nor do we want to know at this point. So pregnancy is also an absolute contraindications. Obviously, people with bleeding disorders, active bleeding disorders, or acute thrombosis, they are also outside of the question. Any kind of acute febrile processes, people that are pathologically afraid of electrical currents, they shouldn't be put under this therapy, at least not before being treated for this prior problem. And some vaccines in the recent time, we have seen even up to 4 months prior to starting the treatment can trigger adverse reactions. We have seen that with influenza and also with COVID vaccines. So there are relative contraindications, and in these relative contraindications is precisely where the body of evidence is starting to pile up, and maybe some of these are going to be lifted. In people with cancer, we always use that with the allowance of the equipment of the team that's treating the oncologic patients. People with uncontrolled epilepsy are also to be off any kind of electrical therapy. But bear in mind that if they have unstable epilepsy and don't have any kind of crisis for the last 6 to 12 months, this therapy can be considered if no better alternative is to be found. So people with really high sensitivity to the device, that's proven that, we leave them off. People with skin infections, this is relative. We have proven that NESA can help heal up skin infections and even autoimmune skin conditions such as pyoderma gangrenosum. And the rest you can see there. Of course, we need to be cautious of any kind of uh, problems, but these are more related to electricity and not with the therapy itself. Well, we usually like to say that this is one clinical device, and in the setting of complex and even more growingly complex system of healthcare. Our patients are developing chronic diseases. These chronic diseases are intertwined within one another, and many of them are under very, very different treatments, be that drug therapy, be that other alternative measures. They all are not treated with but one device or pill. So if we want to see that our intervention is to be of any use, we need to do some measurements. Some of them can be solved via devices. The NESA device comes along with a validated heart rate variability device, the WeCardio, and this is one of the mainstays of interrogating autonomic nervous system function. We can do repeated cortisol measures, and we can use actigraphy to measure sleep quality. We can also do whatever we usually do in our clinic when we want to evaluate the development of our patients. In inflammatory bowel disease, we use calprotectin, we use endoscopic treatments, we use CPR testing, CPR, ultrasensitive CPR for inflammation. But there's also validated scales for many problems, and we use them regularly so that we are not blinded by our own intention to help our patients, and we don't incur in selection or any other kind of biases.
What is about the technology, the NESA technology? Well, at first, we have not only the device, we have always access to the information, to the knowledge. Not only the non-invasive neuromodulation, also the autonomic nervous system. If we understand better the autonomic nervous system, we can get results and treat better our patients. We should to always to have this clinical reasoning, and if we have more information and more knowledge, then we can treat and get the focus in the problem in a better way. Then we have this clinical campus. We have always um, expert in non-invasive neuromodulation for know about the pathologies, the dysautonomies, and also for know about specific things like we have a monography of sleep quality, the for sleep drive. We have a monography of urogynecological treatments, and we are working also in a sport monography for improve the performance in the patients. Then with the technology, there is a lot of people working for this, for get the better support, and not only for get the support, the technical support, always forget a clinical support. The personal support, it's that we can answer you the questions that you are going to have in the beginning. This is very important because this is amazing technology if you use it. And for use it, you need to be sure about how it works. Okay. Then there is some doubts that get in the beginning part, but not when we are 1 year, 2 years using. Then we don't have so much doubts. What are the highlights of this presentation? Well, at first, know that the body is not only a mechanical and chemist system. We have a lot of integrated systems, and the integration of the system is with the of all living beings is electricity and bioelectricity. Then we have the autonomic nervous system is one of the modulators of this living, of the whole living beings, and this is a reaction system. Then we have this technology that seems to modulate the autonomic nervous system. I use it for 6 years, and I have now no doubts about that it influence in the autonomic nervous system. But the evidence is working, and it's they are working in the University of Las Palmas de Gran Canaria for get all this medical evidence for use it in a better way and with these results. And then what are the indications? We have a very specific indication of this technology, and this the sleep quality, the sport performance, the overactive bladder, the focus, the pain, the chronic pain, neuropathic pain, the pain. This is incredible, and we have always a support to the people for the clinical support, the technical support, for understand and know how to use this technology in a better way. And well, now remember you have this column here for the questions, and we are hoping you that you write questions and we will ask it. Well,
So I see Melanie has a question. I'm going to read that for the rest. Thank you, Melanie. I have a patient who has a problem. Okay, what happens that she apparently suffers from urine loss when she laughs. When she laughs, could Nesa help her? Well, as Fabiola told us, the beginning should be clinical reasoning. So, might this be? I'm reading. It's a she. Might this be a postmenopausal woman? Has she been with? Has she had children? Could this be an effort continent problem? Might this be maybe um, a hint towards a more complex problem. Maybe this is a younger girl and this is a MS symptom. So I'd like to know more of the patient, but be as it may, NESA is definitely really active in pelvic floor problems. But Fabiola can tell us more.
I can, because it's sure we need to know more information about this patient. But in general terms, if the patient suffer incontinence, laughing or coughing, then maybe it's more not a incontinence of urgent incontinence is more is a tissue problem, it's a muscle problem. And then with physiotherapy, we always that we have this problem before, we treat with physiotherapy, with exercise, with pelvic floor exercises. And in general terms, we don't know this case, but in general terms, they improve with physiotherapy. And maybe if the patient have overactive bladder, this contraction of the detrusor muscle, then that is a neurological problem of the area, then maybe we can use the NESA treatment. But in this case, I think maybe exercise or other type of treatment can be more helpful.
Stephanie asks if NESA can help with shingles. If it is a primary infection, then no, because it's one of the main contraindications. But if it's the reactivation of shingle or shingles derived neuropathy and neuropathic pain, then of course, and in fact, I use it regularly for my elderly patients after the skin is completely out of danger. And sometimes, depending on the metamer that's being activated, I also use that because bear in mind, we're going to introduce the therapy via gloves and socks and also the directional electrodes. So you can avoid the places where the skin is affected. And it's really, really helping patients with that. Thank you very much, Stephanie.
We have a lot of patients with neuropathic pain or post-herpetic pain, and it's neuropathic, and we can this treatment can be very very useful for a chronic pain, but not in the acute phase is one of the relative contraindication because of the bones. How easy is it to implement? This is a good question.
This is a tough question.
A tough question.
Should be easy, but well, as Fabiola is more the expert than I am, and I'm more neophyte than, and I'm closer maybe to you, Juan. So I start, and then Fabiola corrects me. So my way of thinking this is the very same way I always use any kind of new treatment I come by. I'm not waiting for a patient to be. I'm not waiting to diagnose any poor bloke that comes to my outpatient clinic and say, "Well, you have lupus, belimumab." So I'm not shooting with my therapies, but I'm always aware of when a patient might have autonomic dysfunction triggered by his or her disease, or maybe apparently unrelated to that. And I've become quite sensitive to that. And for all these people, I usually advise NESA therapy as an adjuvant therapy. So that would be my way of the most hard to implement. The most hard thing by implementing NESA is selecting the patients. The mechanical part of actually implementing that is really, really easy. So maybe Fabiola help me out.
Yeah, I think it depends of the motivation of the clinical part, because for 6 years we well for 3 years we help other healthcare professionals to implement this in the clinics, and I think the people who want to improve the patients they do the change that it be necessary for implement this. And the good thing is that it's very, very, very useful and easy for using. You don't have to to learn about manual abilities or skills. No, it's only put the electrodes and let the people quiet. Sometimes, if you are a physiotherapist or you're a manual therapist, you can do your work, your exercise treatment or your manual treatment with the device because it's very versatile. We have in Spain now a couple of psychologists making psychotherapy with this, using it in the therapy because we decrease the sympathetic tone. Then, if we is only see the way to complement the treatment that we used to do. It's not so new treatment. It's only a complement because we are not going to stop doing other treatments. This is a plus always.
Yeah, so we have an update in Melanie's patient. Uh, yes and yes. So NESA is going to be of some kind of effectiveness. I don't know how much. It's definitely going to help. Bear in mind what Fabiola said. The longer and the more chronic the problem, the more the higher the number of sittings of sessions you're going to need to induce a change. But what I would definitely advise it would be exercise. It's not one thing or another. It should be both, and even drugs when they are useful as well. So this comes to some to add to our arsenal, not to make us choose. So
Yeah.
Fabiola.
There's three types of incontinence: the effort incontinence, urgence incontinence, and a mixed. There is someone that is mixed. Then there is some questionnaires that you can make to your patient to get sure if it's a effort incontinence or urgency incontinence or mixed. And if this is from urgency or mixed, NESA can help. But the effort incontinence is going to be better the exercise, sure. We know that there is a lot of people seeing us from Canada because we are going to fly to Canada for training in February, and it's very interesting to contact and to if you want to get all this information face to face. As Albert Einstein said, insanity is doing the same thing over and over again and expecting different results. If we continue to treat our patients in the same way without exploring new alternatives, we are limiting their well-being. Today, we have seen that the future of medicine has already begun, and it's not about doing down the same old path. It is about having the courage to embrace the new, the transformative. NESA is a technology that represents this development. We invite you to learn more about this new technology. If you are in England or Canada, you are lucky to have these great distributors, Remington in Canada and Venn Healthcare in UK. In addition, next February, from the 3rd to the 8th, we will be in Toronto, Canada, training all healthcare providers who want to start taking care of the autonomic nervous system of their patients. If you want to be one of them, here you have the contact. Thank you very much for participating in this webinar, and we hope to see you again. Goodbye.